So, hi there, my name is Julie Robb, again with Ida Culver House Broadview. Before we start today's presentation, I'm going to have, well, after we start, I'm going to have Anita just kind of tell us a little bit about herself and her background. And so now on to our main event. We're honored to host Anita, who will be presenting on changing our perspectives on care transitions. So I am going to go ahead and stop sharing my screen here and let Anita do that.
Great. Hold on just a second while I get my screen up, everyone, and then I'll introduce myself. Okay, so are you seeing my notes screen, or are you just seeing a big PowerPoint that says changing the way we think about care transitions?
We are seeing your notes screen.
Ah, okay. We had that down for a moment.
There you go.
There we go. We're good. Excellent. Okay. Well, thank you, everyone. I'm so pleased to be here. I'm Anita Souza from the University of Washington School of Nursing here. I'm actually joining you from my office. It's one of the first times I've been here in 18 months. So I'm really pleased to be in the office, but do wish I could be there in person with you guys. But such is the way of the world, and we're going to make the most of it. I have been interested in aging from, I can't remember when it started, very early on. I have a wonderful grandmother who I was very close with, and then I just fell into aging. I started working in the assisted living environment back in 1993. So like when I was 3 years old, let's say. It was always something that I loved. I started out as a dishwasher when I was in high school, and I said, how can I make a career out of working with older adults? That was my passion. And so it is what I've done. I went on to get a bachelor's degree in gerontology and management and worked in assisted living and long-term care. Worked for the Alzheimer's Association, traveling throughout Washington State, educating individuals who were newly diagnosed with Alzheimer's disease and other memory disorders. And then I was very much drawn to who are we not serving within older adult services. And that brought me back to the University of Washington to get my PhD in nursing science. And I focused on older adults who were living alone with cognitive impairment. And that's primarily the population that I work with now, and with a real focus on underserved populations within that. So I work within permanent supportive housing and within shelter to identify how to really help those individuals who are very poorly resourced to maximize their aging years. So, and to help their staff with that as well. But today, what we're going to talk about is one of my favorite subjects as well, is changing the way that we think about care transitions for individuals. And what I'm thinking about here is when we talk about moving someone to a higher level of care, whether that be from home into an assisted living environment, or if we're moving an individual in assisted living, in maybe more of a traditional assisted living, into memory care. So those are some things that we're going to talk about today. And our objectives is we're going to talk about that transition. We're going to talk about the impact of memory loss, and then some of the therapeutic approaches that actually happen in the living environment to maximize the experience for individuals, both the individuals who are living there and then their family and caregivers that are a part of this transition as well. All right, can you guys see my assisted living? Okay, so over 800,000 individuals nationwide are living in assisted living, and over 50% of residents in Washington are over age 85. So in Washington State, over 50% of residents have a memory loss disorder as well. So that is an enormous amount of the population that's going to need support and going to be looking at some point in time about these transitions to assisted living. So assisted living, it's a significant move for individuals, and really simply stated, it's not just a move from point A to point B. There's a lot more that happens along the way for individuals. And the space is just not empty between that. It's what happens between that space is life. And so what that might look like is 50 years of marriage. It might look like kids. It might look like living single. But in nearly all cases, a move says that there's perhaps a health concern. And one of the most significant ones that we talk about is memory loss. And it's really hard to overstate the impact of a move for an individual, regardless of the memory impact. It's a hard transition for everyone. And in many cases, this is not to discount or to second guess the move. In most cases, it's absolutely the right thing to do, but we just need to realize and appreciate the challenges that come from this transition. Okay, so are you guys keeping up with me on the slides here? Is it showing making a move?
No, it's still on assisted living.
This.
There it is.
Okay, so I'm not sure what's happening, but we will make sure that we're following along here in the right way. So making a move. So hang on with me a little bit as we explore this metaphor of travel, because as we prepare for a move, really what we have is a lifetime of memories that we've packed. And this is the baggage that we carry. And I really say this in the most positive sense of the baggage that we carry. And the reasons for and timing for a move are very personal, but they often encompass a desire to augment or to bolster an individual with support. And it's also often that the caregiver is the one that needs the support and that's actually being provided an extensive amount of support with the move as well. And it's either through help with daily activities that's something that they need, or really that they need an increased social and peer support. And assisted living is really uniquely designed to meet those needs through their programming and services. And what often comes up as we look at these options is the question of memory support. And when is the right time to make that move for a loved one and into that level of care? So we're going to dig into this part a little bit deeper. Okay. So research in this area has long been guided by a theoretical framework by a very well-known gerontologist called Paul Lawton. And it's the idea that there is a person and an environment fit. So when you're thinking about moving your parents or moving yourself, you're also in a way utilizing this framework as you think through those decisions. So I'll tell you a little bit about how that might be that you're actually utilizing this framework. So on the y-axis here, we have competence. And competence is the ability to meet the demands of our environment or our living situation. And it's measured from low to high. And on the x-axis here, we have the environmental press, and it's measured from weak to strong. And what the environmental press really is the demands of our environment. And so not to get too hung up on this model, but to think about, to live in our daily environment, it needs to be a match for our competence level. And our competence in mastering that environment goes hand in hand with our ability to adapt. And as we age, our ability to adapt can be challenged. And one of the ways is through memory loss that it can be challenged. So there's a sweet spot where we're looking for, and that's when we're not overwhelmed with the demands of our environment and when our environment is a fit to our needs. And that is really when an individual can flourish. So a simple example of this is the home environment. And if an individual's living, say, rurally in a 2-story home, that's their physical environment. And the person level factors that they might be, let's say, diabetic, and they have limited mobility. Independently meeting their needs is going to be really hard for them, and they're going to need support. And enter in the supportive environment of assisted living. That is going to help that individual adapt to their environment. Okay. So at this stage, let's take a little bit of a step back and talk about what dementia is so that we all have a firm understanding of that as we delve into these topics a little bit more. So within dementia, we usually talk about it being an umbrella term, and it encompasses many different types of dementia. And we often then go and take this and break it down into 3 categories. So we have progressive, non-progressive, and reversible forms of dementia. So progressive memory loss disorders will continue to progress independent of the environment in which an individual lives. So in progressive dementia, we have something like Alzheimer's disease, which accounts for over 70% of the dementia diagnosis. That is a progressive disorder that is going to result in increasing decline of memory and ultimately will lead to the death of that individual, often with additional comorbidities. Then we have non-progressive. So we see individuals who maybe have traumatic brain injury, they've got maybe something vascular going on. And we actually have vascular dementia that is in both of these categories of being progressive and non-progressive. So an individual can have a vascular event, say a stroke, and they have just a one-time loss of functioning. Maybe they haven't recovered from that functioning, but it's not going to be progressing in a way that an individual with a vascular dementia that's having multiple uncontrolled mini strokes or TIAs. And then we have reversible forms. And it's always good to know about these and keep these in mind as you're meeting with your physician, because the reversible can be a very severe depression or anxiety that can really mimic what we see in some of the progressive dementias. Multiple comorbidities. So when an individual has uncontrolled diabetes, uncontrolled blood pressure, that also causes symptoms that are very similar to what we see in progressive dementias. Metabolic problems, medication side effects, sometimes people having multiple medications that are complex, adding a complexity to their medical condition. Infections, urinary tract infections is one that's often cited. And then normal pressure hydrocephalus, so water on the brain, that's a reversible form of dementia. So all of these are important to know about, keep in mind, and you might already be dealing with a known diagnosis as you're looking at different living situations. But let's unpack what it means to have dementia in your daily life and to think about the living environment for those individuals. Okay, so we have the daily impact of memory loss, and it impacts in 3 major ways: in executive functioning, in memory, and communication. Okay, so when we think about daily life and executive functioning, this is how we get through the major components of our day, right? It's about the planning, it's about the setting, and it's about managing goals, right? Things that we have to do to move through the day. Initiating action and anticipating the consequences. Regulating actions and our responses to those are also part of executive functioning. Our working memory, all of our decision making. Think about what is involved just in your morning activities, the decision making that's involved there. You know, if you think about it, it's getting out of bed. Maybe someone needs to take the dog for a walk. It's making coffee, making breakfast. How many steps are involved in each of those? And the steps that are involved also have a decision-making component to them. So making sure that if you're turning on the oven, you're also turning off the oven, that you're making sure that there's nothing on top of the stove that's going to burn. Are you turning on your curling iron, making sure that you're turning it off? All of those are decision-making skills and activities around planning, and those start to get impacted, and then we start to see what we talked about in that environmental press, and that they're not able to manage their environment. Okay. If you see me looking off to the side, it's because my computer is not allowing me to effectively use these two screens, and so I'm having to manipulate them separately. But in our daily life, our memory, we often take and break it down into short-term and long-term memory. And I think many of you might have heard this analogy with the filing cabinets. It's something that we use a lot, is that if we think of our short-term memory, those are the files that are close up at the front that are easy to retrieve. And then we've got these long-term memories. And if we think of every file folder in there having a label on it and us being able to retrieve it. In our short-term memory, those are the memories that are most recent to us. And those are often the ones where individuals start to have trouble if they have a dementia. And that's where we also start to see the challenges come up with individuals who are at home, perhaps living alone, is because their short-term memory is impacted, and that is impacting every decision and daily activity in their life at home. And then we have the long-term memories, and those are very well-coded memories. They've got very good file structure to them, and we're able to recall those often for a very long period of time. That's why someone can tell you a very detailed story about what happened to them in 1955, but they can't tell you about the thing that happened just 6 minutes ago to them. And it's really something that's very real to them. Okay. So some of you might have seen this before. You might have actually been tested on this. Can you guys all see a clock?
Yes, we can.
Excellent. So this is called the mini cog assessment tool, and we use this to look at an individual's short-term memory and also their executive functioning for organizing and structuring of information. So individuals are asked to draw a clock, and they are also asked to recall 3 words. And you can see on this one, this is actually a research participant of mine, and he was only able to remember a couple of those words there. And it was actually just one. And then this is the clock that he drew. And they're supposed to put the hands at 10 past 11. And you can see that even in drawing the clock, started out at 12, went to 1, and then just kind of did this free fall down to 7, and then started to do a little bit of correction, but the hands are also wrong. And so what this tells me is that I need to have some concern about this individual's short-term memory and their executive functioning. And this is also an individual who was living alone in an apartment entirely by themselves and was responsible for all activities of his apartment life, including medication management. And so this really gave us a clue and said, you know what, there's some challenges here that we're seeing right now on this test, but we imagine that there's also significant challenges in this individual managing independently with their diabetes medication, with their blood pressure medication, and also with cooking, as evidenced by this clock that they weren't able to follow the direction. And so this really gave us some insight and allowed us to start having that conversation with the individual about making the transition. Okay. So daily life, it's also entirely about communication, right? It's initiating those interactions with individuals, following up on conversations, and maintaining focus. And we see that when we maybe go to visit a loved one and they might be living alone and they're really having trouble telling you a little bit about their day and initiating interactions maybe with their neighbors or reaching out to someone. And so these are all indications that somebody might need a higher level of care. But there's also things that when an individual moves into a different living situation, that all of these are going to be helped by that change in living situation because they're going to have people around them that are going to support them in initiating interactions. When they're not able to follow the conversation, they're going to help them along. And then they're going to be able to maintain those important focuses, maybe, but in a different way. So now we get to something that's really challenging in the move because sometimes unpacking is really about unpacking the feelings and the emotions that we have for ourselves. And these can be more of the hurdles that we experience. So let's unpack a couple of the most common ones that I hear. So this first one, I promised I would never. And this can be a really hard one because sometimes based on our conversations that happened either between mom and dad or with adult children many years ago, you might have said this because you made a promise without the knowledge that you have today about your mom or dad or partner's functioning and the necessary supports that they might need down the line. And the idea of having them placed in a locked facility, as I hear often, it permeates an individual's thoughts, and it's really hard to set aside that. But we're going to talk about how we give ourselves a little bit of grace and help through this one, and that it might not be as hard or as bad as you thought it would be. So a little bit, how about a little bit more help? That's another one. So sometimes issues start to crop up that we're seeing in the home, and people are inclined to say, let's just keep the course of living alone or living at home. And what we're going to do is we don't want to exacerbate this with another move, all these challenges. So we're just going to bring in a little bit more help. And so they really start to significantly augment the services that an individual has at home. But maybe that individual would actually do better if they were in an assisted living and with more folks around them and having that support and having that consistency that can happen in assisted living. And it's not to say that's not okay as just a stopgap, but you might, by having those augmented services, you might actually be preventing an individual from thriving in many ways. And sometimes I think of it a little bit more like moving somebody to the head of the class when you actually make the move. And sometimes making the move before you think that you're ready or they're ready for that move. So as we talked about, as memory becomes more impaired for individuals, we see them start to struggle a little bit more to engage in their environment. And that's when we start thinking about making the move to memory care. And as I said, a lot of people want to hold off on this for as long as they can, but actually for the individual with memory loss, moving them to a memory care environment is going to support them, and it's going to move them a little bit more towards the head of the class and put them in an environment that is not, if we go back to that model that we talked about earlier, it's not going to continue to put that press on them. And so they're actually going to start thriving. And this was an article that was put in play. I think this was back in 2009. It was a great article that talks about the transition from assisted living to memory care. And it looked at the perspectives of the administrators. And these were some of the common areas that they saw as indicating a move to memory care. So individuals who are having trouble with wandering or elopement from a facility. And once you make the move to memory care, some of this really starts not to be as much of an issue because of the way that the environment is set. So I'll show some pictures and we'll talk about that a little bit more. Behavioral and safety issues. So when I talked in one of those earlier slides about initiating conversation, and that is one where we start to see that an individual, maybe if they're in traditional assisted living and they're in the dining room at dinner time, they might be having a really hard time initiating conversation, making sense of what is happening in that busy dining room. And so you might start to see what some would consider a behavioral issue or a safety issue in that particular environment. And that's because that traditional assisted living is exceeding what they can adapt to. And so if you move them to a dementia-focused facility, you're not going to see these behavior issues as much. When individuals are really needing that higher level of care, that's also an indicator to be looking at memory loss. And difficulty socializing, as we mentioned. You know, if you're in dementia care facility and you're playing bingo and you need to get up and you need to leave, that's okay. You're okay to get up and leave. We focus on failure-free activities in memory care. And that's not the case that happens for individuals who are showing signs of dementia and they're in a traditional assisted living environment. Okay, so here's one for you guys to be participating in. So I want you to really focus in. And if we could take off the mute, I wonder if folks can tell me what they're seeing.
Person with flowers on their head.
Mm-hmm. Mm-hmm. Can you describe that person?
It looks like an older person with a beard.
Yeah. Yeah.
And kind of a weird guy with the hair drooping down from the eyes.
Yeah. Does anybody see anything else?
I saw two people originally. Now I've kind of lost it because I'm seeing the man.
But see, what you're doing there is you're focusing in and you're making a transition. And that's what I want you guys to do. Okay, so can you see that red line around now?
Mm-hmm.
Okay, so in the foreground, what we saw was this older man. And now what we see is we see two people embraced in a kiss.
Yeah.
Right? Can folks see that? And that's really the metaphor for what it is like to make some of these transitions, is to look beyond what we're seeing in the foreground for a person and move beyond and get into their world and make their environment work for them. And that's what we have in dementia care facilities. And it's important that our perspective change along with that. And that does mean letting go of some of what we had an expectation for. Maybe we expected actually that we would be the caregiver for our partner or for our mom or our dad. And people often feel that they're giving up their caregiving role when actually, when you make the move, it might allow you to be that daughter again, or that partner again, and be with them in this time in their life rather than the direct caregiver. And that can really be a benefit. But let's talk a little bit about what that new lens looks like. The new lens looks like going from disability to ability, and it's encompassing whole person care for the individual. And it's really about increasing engagement. And that is what assisted living is so good at. And it's now, I've been involved with this, like I said to you guys earlier on, for a very long number of years, and I've seen a lot of transitions, and now all of those transitions have some evidence base behind them, which is really exciting. And we know that successful transitions have to do with the staff and the environment and the structure that is assisted living. So let's dive in and look a little bit at what that looks like. And I've taken actually some pictures here from Era Living and looking at what the memory care environment looks like. Some people have been a little bit scared to look at this, or they say this, my mom or dad would never live if it wasn't in their home that they've been in 25 years. But let's look at this and see what is actually evidence-based and what is therapeutic about this. And so when we think about those reasons for individuals moving to a higher level of care, one of them was around wandering and elopement. So what are you guys seeing as you see this picture? Hopefully you guys are unmuted.
Books.
Mm-hmm. At first glance, it looks like a bookshelf, right?
Mhm.
Yeah. So this is at the end of a hallway where there's double doors, and that is actually a piece of vinyl or wallpaper that looks like a bookshelf, but it's actually double doors,
Mhm.
right? And so for an individual who's maybe exploring the environment, wandering around, this no longer looks like a door that they want to exit from, right? This looks like a bookshelf. And I've seen these so successfully implemented, where an individual walks up and they look at that bookshelf, and then they turn around and they keep on walking. And it was not a disastrous event to come to that door, because I've seen the other side of it as well. I've seen, I used to work in a facility that did not have something like this at the time. And there was a door, and it was commonly at, the end of the day, people gathering at the door because they wanted to go home. And it was very distressing for those individuals that saw this door as an exit point and they wanted to go home.
Wow.
Having something like this changes the experience for the individual. And you've taken away that anxiety, and you've added a therapeutic element here. And there's many ways that we use these therapeutic elements. Another example was that these have been used on elevators. And we also have used carpeting in front of elevators, because one of the ways that dementia changes your brain is it changes your eyesight as well. And so individuals have depth perception issues, and sometimes they see large blocks of carpeting, like if it's a large darker block of carpeting, as a hole or something to be avoided. And there's ways that we use that in a positive way. So in front of an elevator, we had a very dark piece of carpet, and people did not want to go near that dark piece of carpet, and that was enough to keep them from going near the elevator. So it's amazing what can be done in the environment, but to think about how therapeutic that is for the individual in reducing their anxiety, it kind of changes your perspective, I hope. Okay. So here's another example of the therapeutic approach is making sure that there's an outdoor space that is safe, it's welcoming. There's no wrong turn here that an individual can make. They can walk around the environment. The fence is high. There's not an exit point. They can sit wherever they please. They're protected from too much sun. There's many shade spots here. And so that is, and access to the outdoors, that really is also an energy component, allowing people to get out and exercise and release some energy. All of those are really helpful in the behavior and safety needs of individuals. Okay, another one that we see here. So this picture is a really great example of a constellation of design elements that really have come together very nicely to create a therapeutic environment. Can anyone identify some features that you think might be therapeutic after a couple of those examples that we had?
Maybe a place to sit down, the chairs.
Absolutely. And there's several chairs that we're seeing in this picture here, and they're nicely placed. They're not too far apart from each other.
Well lit.
Lighting, yeah.
Absolutely, absolutely. Nice bright lighting, but it's also soft.
What about the exit sign?
What are you thinking about the exit sign?
It would lead in that direction. It would lead you toward that direction.
Yes.
I don't know if that's a good thing or not.
Sometimes, because there's so much interest that's here with the carpeting that's drawing the eyes downward. And then also with the pictures that are on the wall, these memory boxes. Oops, I just gave away some of the things. But those might pull an individual's attention away from that exit sign.
I see. Okay.
Yeah, because we still have to comply with fire codes and whatnot. So we do need those exit signs. Yeah. How about some other things?
In some ways, I would think it's a little bit confusing because it looks like a hallway. It's got a lot of turnoffs, but the painting is all similar. The colors are fairly similar. So it'd be easy in a way to get confused, like which turnoff is yours.
Right. And what I guess we're not seeing here is that a lot of facilities are now designed with a circular path. And so you might be going down this hall and then taking a left and just continuing to go around in a circular path. So you won't find that you're on any one end that you're stuck at. And that's really helpful for individuals. Anything that might help individuals with wayfinding that you might identify here?
The carpet, just the carpet, follow the carpet.
The carpet has a nice path. Follow the yellow brick road a little bit here, right?
Yeah.
So it has that. There's also off to the left, you can see these memory boxes that are personalized that have pictures of an individual here. So that can help an individual who's in the kind of that early to mid stage in identifying what is theirs, because they might identify a picture of themselves there. And it also is an amazing tool for walking around with other individuals and doing a little bit of storytelling, right?
Mhm. So it is memories of the particular individual who's living in that apartment.
Of that individual in that apartment.
Uh-huh.
Yes. And I usually tell individuals to personalize this with any photos that they choose to, but oftentimes as dementia progresses, an individual doesn't realize a current picture of themselves or their children, their adult children as they are now, but they realize a memory from the past, as we talked about those long-term memories. So they'll recognize a picture of themselves from many, many years ago.
Hmm.
And a picture of their baby daughter from many years ago. And sometimes people adopt that memory box is theirs and they'll tell you a fabulous story about it, and that's okay too. And then, so another thing that is here is you'll see those, what we would call chair rails kind of halfway down the moldings. And those are nice and thick and allow individuals to grab onto them and maybe use them to support in walking. Because as an individual's dementia progresses, oftentimes we find it extremely challenging to get them to remember to use their walker or a cane, and they might get up from a chair and leave it. But this provides a little bit of additional support for that individual. And all of these are things that are really unobtrusive in the environment, but that maximizes living for the individual with memory loss and allows them to just live and be. Yeah. Okay. So I encourage you to look around at some of those things the next time you make a visit. All right. So also the therapeutic approach of socializing. And it looks like here folks are playing the Wii games and playing some virtual games. And this really blows individuals' minds when they see their mom or dad or partner doing something that maybe they didn't do at home. And that's really the gift that staff can bring to this in really engaging in some new things and different experiences, and that individuals can have fun with, and they can explore and they can participate up to their own level of participation. And there's no shame in not being able to do it. There's no burden, but that they are able to participate as they can. And folks have been, pleasantly surprised to hear their mothers singing. And they're like, oh, she wasn't singing at home, or she wasn't singing at church. Well, there's something that happens in the environment in memory care that is pretty magical, and nobody's really paying attention to whether or not you're on tune or you've got the right words. It's just a failure-free activity for everyone. And that's really maximizing and bringing an individual to the head of the class, like I've said many times. So those are some ways to think about the environment and how the environment is really bringing evidence-based practice to maximize living. So as we conclude, these are just some tips for successful transitions that I want to leave you guys with, is to remember to engage a therapeutic lens when you're looking at environments and looking at making that transition. Is the home that you're living in right now, does it have a therapeutic component to it? Is there something more that's needed? And is it time to look at that higher level of care? Destigmatizing that higher level of care and that move both for yourself and for the individual as well. Engage staff. This is really their forte, and engage them in every aspect of the process, because this is where they can help you and maximize things. Expect that there will be a transition time, both for the individual who's moving in and for yourself as well. It's quite the transition. These are folks that are leaving their long-term home, right? Their long-term neighborhood. Maybe many things have happened leading up to that transition, and it's hard. One thing that often comes up as a question is whether or not I should engage my mom or my dad or my partner in this in this move, and how should I do that? Should I have them participate in every aspect of the decision-making process? And often for an individual who's experiencing dementia, that's too much to ask of them to participate in every aspect of that. It's putting a cognitive load on them that's too much for them. And so give yourself a little bit of grace there as well, in knowing that it's okay not to include them in every step of deciding what moves into that apartment. Yeah. So I am going to stop sharing so that I can see you guys on my full screen and open it up for conversation and for questions. And then I also have my contact information that I'll share at the end. If you have any questions you'd like to reach out with me, I'd be happy to answer those.
Wonderful. Thank you, Anita. If you guys have any questions, feel free to type them in the chat box.
Or feel free to just go ahead and, if you don't want to type them in the chat box, just go ahead and unmute yourself and let me know what your questions are or comments.
I'd like to ask a question.
Sure.
Would you have someone who is not in memory care, in assisted living right now, listen to this particular presentation? Or is things like this?
It depends. So is this somebody who you're thinking would benefit from being in a memory care?
Eventually. Right now it's assisted living, but it's only been maybe 6 weeks or something like that.
Yeah.
But she does have dementia with Lewy bodies.
Mm-hmm, mm-hmm. Yeah. Okay. So sometimes it can be a little bit hard for an individual who's got that progressive dementia going on to make the choice to move to memory care. And whether or not this type of a presentation would help them with that, what actually might be more helpful is to destigmatize the actual experience of moving up there, and if it's up or if it's down, but to have the individual maybe go and have lunch in the memory care.
Okay.
Participate in some of the activities within the memory care. And that's giving them an experience rather than telling them what you think should happen. That makes sense?
Yeah, thank you.
Yeah.
I have a question.
Sure.
I rate this more as folklore than I do a studied scientific question, but I've heard pros and cons of people talking about, well, when I move mom into this facility, I don't want to show up for another week or two and give the staff a chance to acclimate her, versus the other approach of visiting a lot to help the transition. What is your recommendation?
Oh, goodness, that is a tough one. And it can vary. I've seen it both ways, right? I've seen that what happens when you step back a little bit is that you give of course, the facility a lot of information about your family member, and you are relying on them, and this is their expertise, and they're going to work really hard to make the transition for that individual. And I've seen it work very positively. It also gives you a little bit of a break and a step back that can happen. If you are going to be going daily during that transition phase, you might be encountering a question constantly of, when are you going to take me home? When are you going to take me home? And that can actually be adding to the agitation and the transition for the individual. So that's what I would think I would keep in mind is my presence going to, at this time, be a comfort to them, or is it going to be causing agitation for them and a lack of that transition?
Thank you.
Yeah.
Nita, we got a question here about exercise. Could you speak a little bit about exercise and dementia?
Sure. Exercise is important in every aspect, right? So it's important in managing pre-dementia, before we have dementia, and it's important when an individual does have dementia. And so we want to make sure that we are providing those opportunities for exercise and for safe exercise. You know, the lack of a safe environment to exercise in, to go for a walk, that can happen for an individual who's maybe more in the traditional assisted living and doesn't have eyes and ears on them all the time, or doesn't have that opportunity to go to a safe exercise place. Yeah.
I'd like to ask about data on the consequences of moving people into memory care. Are there studies that look at satisfaction of the new resident? I like the metaphor of moving to the head of the class. This is wonderful. How do new residents report this? And is there information that we could incorporate into our decision making?
Oh, that's really good. So there was a recent article, I actually almost included it in this presentation, that talked about very early on conversations with individuals about the move and the shared decision making that can happen as part of that, and how that increases satisfaction. Mm-hmm. And it positively increases satisfaction for individuals living. Mm-hmm. And so, you know, if you think about that in terms of an individual with dementia, having those conversations, they need to happen very early on in that dementia diagnosis process, right? When they're still able to engage in that. But if as a dementia progresses, the ability to have those conversations and have an individual get to agreement on that diminish over time. Does that make sense? Sure. Mm-hmm. Yeah. Mm-hmm. Yeah. But there is a great deal of satisfaction from individuals who are able to have some of that shared decision making around the move.
Mm-hmm. Mm-hmm. Good. Thank you.
Mm-hmm.
Do you have an opinion about any particular medications? Like, I understand there's a medication for dementia called Aricept. Mm-hmm. Do you have any thoughts on that?
So I wouldn't be able to give any thoughts on that because it's so individualized, and it really depends on the individual, and there are side effects for those as well, and whether or not individuals can tolerate those side effects over time. But there is one thing, that it does come to a point in time when the medications, the disease will continue to progress regardless of the medications, right? And so those, I have a lot of faith in the evidence that we have around what we call non-pharmacological approaches, which are those therapeutic living environment, the approach that staff has with a resident. Those are the things that I think we see some of the greatest benefits from.
Okay, thank you. I felt that way too. I didn't want to subject the person to the side effects, and I didn't know how effective the medication might be.
Mm-hmm. Mm-hmm. Yeah, medication is a complex challenge, and especially, you know, when we talk about behaviors and approaching behaviors with medications. Judy, is this question from Judy?
Yes, it is.
Okay, and you were the one that brought up Lewy body dementia as well, right? Yeah, yes. So you have to be very sensitive with Lewy body and the use of medications.
Okay, thank you.
Yeah.
Another question that's come up, life expectancy with dementia. Can you talk a little bit about that?
Yes. So there's something that we often say that if you've seen one individual with dementia, you've seen one individual, right? And that also goes for what is this trajectory going to look like for the individual with dementia and life expectancy. So it can go anywhere from 3 years on up to 25 years. And dementia also hits individuals who are young as well as those who are old. We've seen it in individuals in their 30s on up to individuals certainly throughout the lifespan. But the way that an individual progresses through their dementia will be individualized because they will have also individualized health conditions that might impact their longevity and their dementia diagnosis. So they might have severe heart disease or diabetes or something like that that's going to also shorten their lifespan or cause additional challenges. Does that make sense?
Mhm.
Yeah.
The question of medication raises another point, which is intervention in hearing loss.
Mhm.
A recent Lancet article indicated that one of the strongest reversibly useful components of aging is hearing aids. And this is a British study, which of course has much more systematized health records. Do you have a sense of the local environment, for example, in Seattle, on the effect that hearing aids have provided those in assisted living versus those in memory care?
Yeah. So that is a really good point. This is Charles, right?
Yes.
Yes, yes. So hearing loss is a huge component and for many different reasons. So that mini cog that I talked about, that test,
Mm-hmm.
and it asks for those 3-word recall: banana, sunrise, chair. You can see individuals failing this test because they don't have the ability to hear what the individual is asking of them.
Yeah, exactly.
Right.
Yep.
So they're gonna fail the test. And then also you have individuals who have hearing loss, who are aware of it, maybe don't have resources or have access to hearing aids or a diagnostic workup for that. They're going to start pulling back socially as well. And then we're going to see the impact of that on their mental health. So it just creates this kind of cascading chain of events that can happen and assumptions being made that are incorrect around that individual.
Exactly. And how do memory care units deal with this? Is this something that is pervasive and that caregivers in memory care are constantly on the alert to
It definitely should be one of those things that we're doing in a total assessment of the individual, is understanding their hearing. Sight is also a major issue as well. All of the senses, right? So having that baseline understanding of an individual's hearing, sight, things like that, will allow us to make changes to maximize any experience that they have.
Good, thank you.
You use the term morbidity. Am I muted or not?
No.
You use the term morbidity. Could you define morbidity?
So morbidity, when I was speaking about comorbidity, I was talking about if individuals have multiple different chronic health conditions.
Okay. Memory loss isn't morbid then.
Memory loss will result in death if it's one of the progressive types of memory loss. But memory loss often comes with it with what we call multiple comorbidities, which means that they have memory loss in addition to heart disease, diabetes, and all those other things that put together for them.
You and I, when you call for on here, everybody sees us.
Anita, thank you very much.
You are welcome.
I think we're just about at time here. So again, I want to thank everyone for coming today. I want to thank you, Anita, for taking the time out to spend with us today, and really, really good information, and we really appreciate it. For the folks who have joined us today, we're going to be emailing out a kind of a seminar evaluation. So we can, as I mentioned earlier, we did record this, so we'll be emailing that out to you. So if you want to go back and hear a few points that Anita made, you can do that. If you have any questions, we would love, the team here would love to chat with you. We have recently opened the terrace here at Ida Culver House Broadview. Second floor is open, and we're getting ready to open the first floor of the terrace, which is a really exciting step for us. So if you have any questions about memory care at Air Living, or specifically at Ida Culver House Broadview, feel free to reach out in those emails that Daniel will send out to you guys. We'd love to answer any questions.
Are you in lockdown now?
We have, I wouldn't call it lockdown. There are specific regulations that we have to follow. We are doing some testing here just to make sure that everyone is safe. So it's kind of a floating target right now. There's a lot of places that are having to close for a little bit of time, do some, close as in just kind of limit some visitors and activities. Just to kind of do some of the appropriate testing, just to make sure that everyone is safe. We are, all of our residents are vaccinated here at Broadview, so we feel really confident with that.
Well, we have a friend who just entered, and she told us we can't visit for the week. Is that true?
I'd have to get specific details for you, but you can, if you want to give us a call or send us an email, I can get you specific details.
Thank you, Anita.
You are very welcome.
All right, everyone. Thanks so much.
Thank you. It was very helpful, very helpful.
You're welcome.